age concern representatives from the lay inspectors as well. If you wouldn't mind leaving that chair at the end empty, and then Tom, we'll get you to come up in a bit as well. Do you want to come up and say? Tom, do you want to sit at the end, and then we'll come to you after these guys have spoken. Don't worry. We'll just so this is the second part of our care in the community reviews. We've got both the CQC and the age concern lay inspectors, and we've got Tom White as well. For those that don't know, Tom's a very active resident and has a short statement he would like to make after the CQC and the lay inspectors have spoken, just about it's about Tower Bridge, isn't it, Tom? And you've got a couple of questions as well, so we'll let you do that after these guys have spoken, but before we.
Okay.
So if you could introduce yourselves to the cameras, that would be great.
Yeah. I'm Helen Wells. I'm an inspection manager at CQC for Lambeth, Southwark and Lewisham.
I'm Jackie White. I'm the Chief Executive at Age UK, Lewisham and Southwark.
I'm Joan Thomas. I'm the Home Care Quality Check Coordinator at Age UK.
I'm Tom White and I'm a lay inspector.
Wonderful. Helen, do you want to start? Have you got some of the brief background and introduction that you want to give?
Yes, I've got, and I think you've got some slides as well.
Wonderful. If anyone hasn't got any, they are up here. They're this black and white. There's a couple here. Bill's got a couple in front of him.
Do you want
more?
Have you got one?
Don't worry,
What's not there? Jasmine, can you take some around that?
You've got one now, Jasmine.
Oh, I've got one.
Yeah, some of
Yeah, we're fine.
them.
Oh, we've got plenty of them. Perfect. So, do you want to here?
What's the stone?
Jackie, do you want that?
We're okay to.
You sure?
Yeah, we're fine.
Okay. Wonderful. Sorry.
That's all right, no problem. So, what I wanted to give you a bit of an overview was firstly a bit about our new strategy, our new approach to regulating, inspecting and rating services, and then a bit about the outstanding and inadequate services that I think have already been talked about, but then also just how we work with council scrutiny for health and social care, which I think would be useful. So, sorry you haven't got colour copies. But I think firstly for me it's really brilliant to be invited because it's absolutely it fits in with our strategy. Our strategy for 2013 going through to 16, we're obviously working at the moment on the next one, responded to the Francis reports and commits CQC to developing relationships with council scrutiny. So it's really brilliant to be here. As part of our public engagement strategy, we've got a framework for working with scrutiny committees across sectors, and we've published 3 new guides for scrutiny committees, for district councillors, and a general guide for all councillors. And I've put some kind of references and stuff at the back.
That's perfect, thank you.
I'm going to go with the copy that you've got because it's a figure. So just a bit about how we're structured. We have 3 chief inspectors that cover hospitals, adult social care and primary integrated care. My role, I'm part of adult social care, so my presentation is a little bit focused on adult social care, but obviously we work in a wider context as well. So what we regulate is treatment, care and support provided by hospitals, community services, GPs, dentists, ambulances, mental health and substance misuse services. Treatment, care and support services for adults in care homes, hospices and in people's own homes, both personal and nursing care, and healthcare for children and children's services. Treatment, care and support services for adults and young people in the criminal justice system, including prisons and youth offending institutions, and services for people whose rights are restricted under the Mental Health Act. So our purpose, which underpins everything that we do, and the whole approach to regulation, is that we're there to make sure that health and social care services provide people with safe, effective, compassionate, high quality care, and we want to encourage care services to improve. Our role is to monitor, inspect and regulate services to make sure that they meet fundamental standards of quality and safety, and we publish what we find, including performance ratings to help people choose care. Andrea Sutcliffe talks quite often about the mum test.
That's so mum, isn't it?
But I think there's been sort of recent sort of discussion about the fact that there's anyone that we love. And it's been, and I think so. What we look at, and these are actually the key questions that we look at in our report. So we look at whether services are safe, whether they're responsive, whether they're caring, whether they're effective, and whether they're well led. And I'm sure that you've seen some of it, and that's absolutely how we structure our reports, and that's what we focus on.
Yeah, I think we've got a couple in the papers that we
yeah. And I think, and what sits beneath that is we have our key lines of inquiry, which we use to, to structure our inspections, and they will sit beneath those standards. So that's what you see reflected in the reports. Our regulation, we believe, is there to inspire improvement. It sets clear expectations. We monitor, we inspect, we publish, we rate, we celebrate success, we tackle failure, we signpost help, we influence debate, and we work in partnership. There's a big picture now, infographic, just really kind of giving you the structure of the new approach. So we start with the registration of services. So we apply a rigorous test. It's legally binding. People have to sign up to the regulations, essentially. And there's a commitment to safe, high quality care. Once services are registered, we monitor, so we look at data and evidence that comes in and information from people. And there's been already some discussions about kind of partnership working and also things like whistleblowing and talking to people in care homes. We're really reliant on the information that comes into us and how and some of the soft intelligence as well as the the safeguarding notifications and the kind of alerts that we would regularly get, such as whistleblowing and those kind of standard sorts of inquiries. So we take a very risk-based approach, so we're constantly sort of monitoring and looking at information, and then we take a risk-based approach to whether we, when we will go out and inspect. So we'll sometimes respond to information that we get in, but we've also got set parameters, so again, I think your colleague mentioned, so if a service is inadequate, we go back within 6 months. If a service is good, we go back within a year. And so there's some structure around it, but we will also bring inspections forward if we've got concerns. So when we look again at our key questions for that inspection, and when we inspect, we are much more thorough, I think, in our new methodology than it was in the past. So I think, and we get that feedback from providers and from inspectors, they find the methodology much more thorough than it's been, and it's much more in depth. We focus on using experts and including experts by experience. So we do a lot of work getting information directly from people, talking to their relatives. We'll telephone people. We'll get a lot of information as part of the inspection, but we'll also use professional expertise. So, for example, some of the examples of the homes that we've talked about a bit today, we might take in a tissue viability nurse or a pharmacy inspector to look at specific kind of technical issues if we think that that's important. So it's a very different regime for providers than people have experienced in the past. And then obviously the output of all that is we rate and we publish. We have our ratings, which are outstanding, good, requires improvement and adequate. And we take enforcement action, and I'll come on to that in a second.
We've probably got about 5 minutes just so we can get to everything else.
Yes, that's fine. Quick. I won't go through in huge amount of detail then our standards and the new regulations, but you've got them there. And there's also a couple of changes around our fit and proper persons requirements at registration. And I think it's worth, given the concerns we have, just touching on special measures. So the purpose of our special measures process is to ensure that failing services improve or close. We want to use the available time to improve services, so we give quite a strict time frame. We go back in 6 months. All services from April that have been rated inadequate go into special measures, and it gives that time limit. If they make the improvements, they come out of special measures. If there's no improvement, we can keep them in special measures or move to cancel their registration. There's also some information here about the way that we publicise the ratings, and we require providers to display their ratings now, and that's a change. We also have a market oversight function as an organisation, so we have a corporate provider team that work across large corporate providers to have that kind of market oversight, which was something that came out of the failure of Southern Cross. I think it's just worth touching on our enforcement powers. So what's changed? Our enforcement powers are much stronger with the new regulation. So one of the things that they allow us to do much more as well is to take into account history of services. So we look at the history, and we're able to look at the history with the new regulations. We can give warning notices to providers. We can impose remove or vary conditions, suspend registration, cancel regulation, and take urgent action if we need to. And we have some criminal powers as well that we can use. In adult social care, there's just some statistics here about the numbers that we've got that are outstanding goods, requires improvement, inadequate nationally. And I just wanted to touch on what's happening in Southwark for you as well. So we've got one service in Southwark that's outstanding, 16 that are currently rated as good, 5 that are rated as requires improvement, and 2 that are currently rated as inadequate. And obviously we're not fully through our ratings programme, so we have a number of services that we haven't rated with our new methodology yet as well.
I don't know if you want to touch on kind of the Burgess Park Tower Bridge one, because I think that's where people probably got some questions
no,
for
that's
you
fine.
well.
So I think I'll skip on to that. Some information and some general information here. Just to start with, the key issues that we found at Burgess Park, and I know you've got the report here, so I've just kind of highlighted really the reasons that the service was inadequate. So the service was not safe. We found issues with people receiving their medicine safely. We found standards of cleanliness that were not maintained, and people were at risk of infection. We also found at Burgess Park that the service was not effective. We found that staff weren't always supported effectively, and that people who lack capacity were not always supported to have their needs and their choices met. At Tower Bridge, the issues that we found again were unsafe, because the service wasn't safe, and we found issues with medicines. We also found that the staff were not always aware of people's needs. There was a high number of agency staff who didn't know people as well as permanent staff might do. We found again that the service wasn't effective, so people in particular, and this has been highlighted, weren't supported really to have their basic needs met around food and water, and that staff were not supported appropriately. And then in addition, we found, perhaps unsurprisingly, that the service wasn't well led, and that the systems to monitor quality were in place but not being used effectively. And we felt that the management team needed strengthening, and that's all kind of highlighted in much more detail in the report. In terms of an outstanding example, and hopefully to end on a slightly positive note, Green Hive Care Home doesn't provide nursing care, so there is a bit of a difference in terms of the care provision. But what we found in particular was that the service was caring. People were treated with kindness, respect and compassion, and I think if you've read the report you'll see there's lots of people's quotes in there about what they experienced and what people experience their relatives having in terms of care. Staff knew people really well, and people were very involved in any discussions and decisions related to their care, and they knew what that was, and again there was just that close working throughout in terms of people working with their carers. And again, linked to that, and I think it touches on the issues people mentioned about good managers, the service was well led. So we found that staff were motivated and supported. And in particular, the inspector's sort of comments on the open culture that was there. So there was a real sense and real evidence that people felt that they could raise concerns and that they would be dealt with. So it wasn't to say that the service never had problems, but it was about the way that they responded and dealt with them, and people's, they felt safe to do so. So I think they were the key things.
That's perfect, thank you. Jack and Jane, should we move on to you and then move on to Tom after?
I'm not going to talk for very long because Joan and Tom know far more than I do because
Okay.
they're on the ground. But I just wanted to give an overview. So at Age UK Lewisham and Southwark, we really do believe in lay inspection, which is why we administer the care home lay inspector scheme for Southwark. But also we raised the funding from Esme Fairbairn for Joan's project, which is a 2-day-a-week funded project to do lay inspection in home care. I've been involved with Tom and the care home lay inspection for about 4 years now. And in that time, what I have seen is the same homes constantly go on and off embargo. There is something systemic wrong. It's not a kind of, it's this home or it's that home. These are the same homes and they go on and off. And a lot of work is done by the council and the monitoring officers to bring those homes back up to standard. But I think there's a resource issue there. It's not a monitoring issue in the end. It's about the resources we put in, and I don't think we're putting adequate resources into our care homes in the borough, and that's why we see them falling. Greenhithe is the exception. It's had an amazing manager for a very long time, and that makes a big difference. When I was looking through the CQC reports, the thing that struck me was that the 3 homes that were inadequate, one had a new manager, and the other 2 had no registered managers. And that's what we've seen too, that constant turnover of managers. And that says a lot about the workforce that we have in the care homes, because it's not just the managers that are turning over, it's the staff lower down too. And I'm going to shut up now, because this is Tom's bit. Joan, I think there's a lot more optimism in home care, and I think it's around the Ethical Care Charter. And I'm really surprised that that hasn't been spread into the care in the home, so that you have care workers working in homes on the minimum wage, and you say that's fine, but it's not fine in home care. And that's why we're seeing that difference, and we're seeing the optimism in home care, and we're not seeing it in care homes, I think. But I'm going to shut up and pass over to Joan to talk a little bit about her project before Tom talks about his.
Okay, so in my project then we go out and we talk to people in their own homes. We roughly look at the same 5 areas as CQC. So, is the service safe? Is it caring? Is it responsive? Is it well led? All those things. And what we're finding as well is that people are telling us, well, no one's ever bothered really to talk to me in this way before. I might get a questionnaire, I might get a telephone call, but telephone calls aren't very good because actually I'm a bit deaf. But nobody has actually sat down with me, and sometimes these visits can take more than 3 hours. They haven't been given the opportunity to say what they want to say. Usually when they're asked very particular questions, or they get a 1-page questionnaire with like symbols, smiley face, no smile, frown. So it's an opportunity to say what they want to say. It's kind of different though in terms of what goes on in home care and care homes, because we aren't going in and looking at provider X or provider Y. This project was set up to identify particular issues and trends. So what is it that makes one person say, yes, I have got such a great home care service, it's wonderful, I can't manage without it? What makes that difference? Why do some people say that, and why do some people say, oh, it's absolutely appalling, it's absolutely appalling? But I have to say that overall, feedback has been quite positive. Can I just tell you what just the 5 biggies are?
Yeah, please do.
You know, in terms of the recommissioning of home care and this project, we are working together quite closely now, but we did start off doing that at the same time. So there's some connected issues and some that aren't. In that, like in this particular project, I'm asking what is most important to you. Southwark now are looking at the I statements. I wish we'd worked together beforehand so that we could amalgamate those together. But what are the top 5 in terms of what's most important to people? And the biggie is having regular carers. And alongside that one, it's the associated lack of proper handovers given to replacement carers. That has been cited in about 80% of cases. That's number 1. Number 2 is attitude of carers, and that covers things like kindness and respect and empathy as well. That's another biggie as well. Carers don't understand what it's like for us to have to rely on carers. The third one is a bespoke service, person-centred care, if you like. This takes a long, long time to come about. It doesn't come about just like that, and it comes about because service users and their family members take the time and effort to explain how it should be done, but also it takes the willingness of the care workers to take on board what's said. I'll just give you the next 2. Social interaction. So care being delivered in a way that makes the person receiving that care feel like a member of society, feel like a human being. And unfortunately, I have actually I've seen home care being delivered in a way that doesn't involve a lot of social interaction, where the service user afterwards has said, that made me feel like a piece of shit, actually. Made me feel like something on a shoe. So, you know, there has to be some sort of conversation going on. And the next biggie, and I think this is appropriate in such a mixed borough, is cultural needs, those being met. And that's been cited from, you know, across the board, all ethnicities, including white British as well. And that can cover, you know, such basic things as food. You know, normally we think of, you know, language support and stuff like that, but food, that's a biggie. So those are the 5 biggies we've identified over the last maybe about 8 months. What we've been doing with the council is that we've been sharing our findings, and we are working together, and we're developing that relationship. And Andy and Rochelle mentioned earlier on that there's going to be a forum on the 19th, I believe, where we're actually going to be talking to care workers as well. So I'm hoping to present my findings and say, look, these are the issues that have been cited by the people getting the service. What do you think about them? Why do you think that is? And the project will continue for a wee while.
Sorry, that's perfect. Julie and I were just talking about how interesting your forum would be.
Yes.
Sorry. Tom, I know you've got a statement and some questions. Can I ask that you just do your statement at the moment, and then we'll take some questions from here, and then you can feed in your questions as well.
Okay, the statement is because you need to know where we stand as lay inspectors and what we can do, and because a lot of people, so what are we doing? And this also involves the council. So this was something that was sent to me by Rita Andrews from the Irish Pensioners about Tower Bridge on the 3rd of July. Ascertain the protocols they have in place for situations arising when a client falls. What procedure is followed when a client refuses to drink? The wife visited her husband, who has dementia, on the 15th of June. He was okay but was refusing to drink anything. At some time during the day, the resident fell in the corridor, as was told to the wife, but no one called the GP or ambulance. The night staff came on duty and saw his extensive bruising and called the GP. Apparently, the staff were told they're not allowed to call an ambulance. The GP arrived and called the ambulance and was admitted to St Thomas's. The wife, who has mobility and breathing issues, was at home upstairs and heard the phone ringing downstairs at 11:30 p.m. It rang every hour until she got up at 7:30 a.m. and answered it when she was told that Frank was in hospital. She went to the hospital where she was told he was severely dehydrated and had a chest infection. She went to the care home to ask what had happened, was told by the staff that he'd gone to bed and fallen getting out of it. She challenged this as she'd already been told he'd fallen in the corridor. The staff became defensive and asked for the name of the person who told her this. They then told her to go to the manager for further information. She arranged to see the manager the next day. When she went, the manager was too busy to see her. Her husband was discharged from hospital on the 19th of June. No further explanation was given to her by the home, but on the 1st of July, Tower Bridge Care Home applied for deprivation of liberty safeguard on him, saying he's becoming aggressive. I reacted straight away and told Jackie here at HUK that as Jackie Hibbs, who was at that time at Southwark, one of the commissioners, had also been copied in, I suggested the first thing we needed to do was to speak to Jackie Hibbs. This was done. We had a reply from Jackie, and this is not any fault or anything, this is just reading it. We had a reply from Jackie on the 6th of July. Rita Andrews from Irish Pensioners, who had raised the issue with us, was also copied in. The following is the reply from Jackie on the council side of it. All incidents and concerns regarding residents' care in nursing and residential homes should be processed as either a safeguard or a quality risk alert, all of which will be managed and processed by council staff. For this particular incident, I will processing this as a quality risk alert. This means that a formal QRA form will be sent to the management team at Tower Bridge for them to investigate the concerns raised below. Once we get their response, this will be evaluated by Southwark's commissioning team, and a decision will be made regarding the outcome. Taking into consideration that Rita Anders raised this, she will be copied into the outcome of this alert. Now, this is where it puts us in a very difficult position as lay inspectors. We never got a reply, unfortunately, from Southwark Council's commissioners. This now comes when you talk about embargoes. People don't entirely understand what an embargo is. An embargo means that they're not going to put anybody further into it. We as lay inspectors, and me in the main, said we would respect this because they've asked us not to go in as these inquiries are going on and there'd be too many people investigating. I have to say, this made sense to me, but I was very, very upset when we didn't get any reply and we next heard that the Quality Commission, I felt they'd let us down. But the whole thing about this embargo, we as lay inspectors, and we're unique in Southwark, we don't have to do any rules. We can go in even if there's an embargo, but you would think common sense would prevail.
Do you have kind of a couple of specific
but you also
questions?
got to remember is that people in there still need looking after. Yeah. So we will change, and I'm determined. I've spoken to the Commissioner and different people. We will work together. I'm determined to. But we're going to be a lot stronger.
Good.
You know, because this is what the public expects of us. You know, Tom White 8 years ago, I would have just said, oh well, I'm not going to do that anymore. But we're going to work. I will sit down. We will work closely together. But I have to say that where do we go from this? I actually think we need to have better standards, even for CQC. There's certain things, for instance, that I've learnt. When somebody you see somebody, and they're literally sitting in a room, and you've probably seen them, and they're dead on the chair, and they're looking into the floor, doing nothing. You will be told that the television's on, the music's on. Now that person, and this is what you say, if we respected things, their needs are not being met. Now, I can tell you they're still getting good gradings because they're ticking these boxes. That is one thing that I've really noticed everywhere I've gone. And that same, because we're lane inspectors and we go there more often, we see the same people sitting there. Now, if that was my mother, and I laugh at this because when we started this 8 years ago, Tom White, the first thing that I said was, if it's not good enough for my mother, it's not good. And I still say that. And I sit down with the people. So I would also ask you a question. How would you deal, a whistleblower told me at one of these homes, how would you deal with the drink chart? For instance, the whistleblower told me is that how they do it in this particular home, one person sits and does it for everybody on that floor. Just sits writing it out. How would you know that? I mean, how would you, doing what you're doing, you wouldn't be suspecting that, would you?
Okay, just quickly, we come back. Tom, have you got any other questions? Because I need to get questions from members of the committee.
That's the real one.
That's your question.
Would
okay,
you,
wonderful. Thank you. Helen, I don't know if you want to come back on kind of some of the stuff that Tom said first, and then I'll open it up to everybody here as well.
So in terms of that specific question about how we check that, and I think that's something, if we found, it depends what we find in the inspection, what people tell us, we'd obviously check charts, but if it, something, in theory you might not, but because we're talking to people, we're talking to relatives, what I'd hope is that would trigger an issue we'd see, in that, in the case of Tunbridge, obviously we were able to see that people weren't getting hydration in the way that they needed, and there were other things that you would look for around hydration, around other things like falls and possibly urine infections that might tell you there's a problem, and I think that's where we're prompted then to dig very deeply and look at what the systemic issues might be. But it does sometimes depend on what happens on a particular inspection, what information we've got before the inspection, what particular safeguarding alerts have come on, and that will tailor, the way that we approach that inspection.
Wonderful, thank you, Helen. David, do you want to start?
Just got two questions. One is in regards to the CQC ratings. I know obviously that you can go onto the website and you can see the ratings for a home, but I don't know for sure whether everyone's relatives check out those CQC ratings. Some people maybe just go to the home that happens to be nearest and decide to see if they can, put one of their relatives into that home. So, I mean, is there any sort of requirement on the care homes themselves to actually tell people who want to place a relative there actually what their current rating is? And if not, is there a reason why they're not required to do that? And the second thing is, obviously, we talk about homes can be put on special measures, and sometimes that special measures can be extended. And the ultimate thing is that you can obviously cancel registration. But in practice, how often does that actually happen? Because obviously, as we've sort of discussed earlier, some of these particular homes are sort of serial offenders when it comes to not meeting the required standards. And I just wonder why they seem to be allowed to continue to provide inadequate services.
So, to do your first question first.
Yeah, it's probably the easier one.
So, they're from April, they are required to display their ratings. So, and there's a slide actually on that. I was one of the ones I romped very quickly through because I was running out of time. But they are required to display them. And that's on their website in the home, so that they're visible to people. And so you should see that now. And it's something again that we enforce.
So that came in this
That
April?
came in from April, so when our new regulations kicked in.
So technically, if we went into any home, we should fairly easily be able to see what their rating is.
And if you don't, you should tell CQC. And then slightly similar answer because it is linked to our new powers from April. So our powers around special measures came in from April. So just because of time, we have only just got to nearly 6 months. So whereas if a service was put in special measures in April, then that 6 months, should be up, and then that process. So that process hasn't had much time to happen yet. But we certainly are taking action, and we are closing homes.
Are you saying that if you're on such for 6 months, you will automatically deregistered, or not?
No. So we look at so it's just. Services improving, and I think there's information that's going to be publicised a bit more about that. I think in the State of Care report about what that's starting to look like and what that picture is national.